After a meeting that involved stakeholders in the health sector, the Kenya Association of Private Hospitals went back on their earlier decision, stating that they will continue to accept payments made through NHIF for the next 5 months.
We have started on a journey of transforming NHIF.
This is following an agreement between them and NHIF that a new contract be drafted by March and will be effective as of July this year.
The contracts between NHIF and all service providers will be signed after the 30th of March or 31st of March, because the 31st March has 31 days. And for implementation, we will start the new contracts with the new benefits on the 1st of July, which is in line with the calendar year for the government. So as such, we can say that we are going on with the old contract for the next 5 months, February to end of June. But as far as making sure that we are all in tandem and in line, we are going to make sure we do that by the 31st of March.
The private hospitals and NHIF had failed to agree over payments made on various services, where private hospitals accused the NHIF of drastically lowering their rates, a decision they say was not in their favor. The Ministry of Health now says that the two are in the process of coming to an agreement that will favor both parties.
We've reached an agreement. There shall be no halting of services at the private sector. We have given ourselves a moratorium period where we shall be able to review the current payment rates. We shall be able to come together around the table and discuss how we ensure care is affordable while ensuring the sustainability of both the private sector and ensuring that you as Mwananchi are also able to access services.
They further said that they will also ensure their terms will favor the common Mwananchi, as well as ensure that health is affordable for all.
We wouldn't want NHIF to collapse, and we wouldn't want private sector or any other institution that provides services to collapse. So what we need is to have a balance that's acceptable on both ends. And the reality is you cannot pay for health care out of pocket. So the only way UHC will be able to work is the prepayment model, which is the NHIF model.
The decision comes as a welcome relief to millions of Kenyans who rely on NHIF to get some health services which they cannot get in public facilities.
Yeah, of course, Kenyans are going to suffer because you find that in our country, somehow we have neglected our public health facilities in such that we do not have the adequate and appropriate health providers in public hospitals, and that is why most of the time Kenyans will be pushed to the private hospitals. What happens now is that those who cannot afford will actually be compelled to go to the understaffed public hospitals. You overload the clinicians who will be seeing patients in public hospitals. You are then going to see long waiting hours.
Stakeholders in the health sector say that this is a setback to universal health coverage, which is among President Uhuru Kenyatta's Big Four agenda.
We are going into a new NHIF where more Kenyans are actually going to be contributing. It's going to manage probably double the amount of money that we had, with the hope that we are going to actually use this fund to be able to fund universal health coverage and be able to provide affordable, accessible and quality services for all Kenyans. To do that, we must ensure that the people who are providing these services are then taken care of, so that they can provide the services without having to suffer the disadvantage of that lowered fee.
Private hospitals accused NHIF of not involving them in the development of the benefit packages and in the 2022 to 2024 contract as indicated in the Constitution. The contract proposed that private hospitals would dictate what doctors charge, the cost of procedures, and what specialists would be paid. As such, they decided to put on hold the contract until a meeting is held on a mutually agreed new contract. Lilian Kamau, Ebru TV.